I am Dr. Anish Gupta, Senior Consultant and Cochlear Implant Surgeon, Artemis Hospital, Gurgaon. We at Artemis have started this cochlear implant program in the year 2012, and till date we have done more than 100 cochlear implants in both national and international patients. So what is cochlear implant? Cochlear implant is an electronic device which is placed under the skin behind the ear, and it has an electrode which is placed inside the cochlea. It helps restore the hearing in the hearing impaired people. Broadly, the indications for cochlear implant surgery can be classified into three groups. First and the most important are the children with bilateral hearing loss. They are born with this deafness. This is also known as congenital hearing loss. Second group includes the adults and the children who have lost their hearing due to some reason. It may be viral infection, maybe due to drugs or some disease. The third group is the most ignored group in our country, and that includes the senior citizens who have lost their hearing due to aging process. And their hearing loss is so significant that they cannot be benefited by the hearing aids. The most important aspect in the children who are born with hearing loss is the early diagnosis and management. The earlier the hearing loss is detected and rehabilitated with either hearing aid or cochlear implant, the better is the speech and language outcome. One of the most important questions that is being asked is that whether the cochlear implant is totally implantable. No, the totally implantable implants are still in progress. At present, we have implants which consist of two parts, the internal part and the external part. Internal part is placed surgically, and external part consists of speech processor which hangs on the pinna and is connected to the internal part by magnetic coil. So how does this implant work? Sound processor which hangs on the pinna has a microphone. It catches the sound and converts it into electric signals, and these signals are then transmitted through the magnetic coil into the implant. And the implant, after receiving these electrical signals, transmits these signals through the electrode into the cochlea to stimulate the hearing nerve. The surgery of the cochlear implant can be done by two techniques. One is posterior tympanotomy, the other one is varia technique. The surgical time is usually 1.5 to 2 hours with hospital stay of 2 to 3 days. The complication rate of cochlear implant surgery is very low and ranges from 0.5 to 8%. The second important question that is being asked by the parents is that whether the child will be able to talk soon after the implantation. Just like the child who is born with a normal hearing does not speak immediately after the birth, and he develops speech after the age of 1.5 to 2 years. Similarly, when the implant is done in a child who has bilateral complete hearing loss, he develops speech after 1.5 to 2 years with extensive speech therapy. To conclude, cochlear implantation program requires good surgical technique, intensive speech therapy sessions, and dedication and commitment of parents and teachers to have best possible language and speech outcome. Thank you.